Hi, I'm Dr. Julie Steinauer, and today I want to talk to you about our topic for the month, which is how can you avoid the homework war or the homework battle zone in your household when your kids go back to school this year. Now, before I get into that, let me tell you about how you can connect with us. Our phone number is 618-288-1489 if you're local to us. If you're not local, go to our website at visionforlifeworks.com and you can do one of two things. Either click on the schedule a consultation, or you can fill out the questionnaire, get a little bit of feedback about your vision, and then it will kind of move you towards, do you want to schedule a consultation with us or not? Now, let's talk about how can you avoid the homework war this year. You know, I hear that a lot. It's a kind of a phrase that I've probably heard somewhere else too, but we definitely picked it up and used it for our patients because many families go through the homework war battle zone during the school year. Getting the child to sit still, getting them to be focused, getting them to do the homework, getting them to read, getting them. Okay, sometimes it feels like for the mom that they're like, have to be in charge. And they don't really want to do that. I am a mom too, and I understand that you don't feel like you want to have to be, kind of like a dictator over your children. Obviously, we have to guide them and direct them, but it's really hard when the homework stuff is such a battle that everyone leaves the battleground really exhausted. So let's talk about what we do in our office in order to help you. If your child is having some vision problems, you may or may not have noticed. And what's interesting is that a lot of times, you may be taking your child to an eye doctor and finding out that their eyesight is fine or their glasses need changed. But are they looking in depth at all of the different visual skills that's necessary for you to not have that battle zone at your house because of homework? If not, if they're not looking at things like tracking, focusing, eye alignment, whether or not one eye is being ignored, if there's depth perception, and what kind of visual attention span and field of vision does your child have, if they're not looking at those things, then you may very well be in that homework war or battle zone. Now let's talk about what we do in our office in order to correct things for your child once we know there's something visually going on with them. Well, our program has two phases to it. The first phase is Syntonics. Now, I can tell you, based on some of the comments that I've gotten from my patients just this week, she's more focused. Her occupational therapist says this is a totally different child. She's able to, do new things. He is trying new things, like swimming in the ocean when he never would have done this before. He's making new friends. He's being more, age appropriate in his behavior. These are some of the comments I've gotten just in the last 2 weeks from patients who are presently working with us. So, and they're both just in phase one. So in phase one, our patients use Syntonics. You've seen my videos, so you know I talk about this stuff all the time. But Syntonics, or photo light therapy, or phototherapy, or just light therapy, it's called lots of things, is a process in which the child or adult, if we're talking about them, is going to take their glasses off or their contact lenses out. They're going to wear a prescribed set of filters for a certain amount of time on a daily basis, usually about 5 days a week. And the time might be as limited as 7 to 14 minutes a day. That's it. And in phase one, which is about a 3 to 4 month part of our program, you can actually see benefits so significant that you might be like those moms who have written emails to me here recently, quoting what I just quoted a minute ago, about them being willing to try new things, opening up, becoming more age appropriate in their behavior. We hear comments about kids, changing and like gaining new vocabulary and being more expressive. Just so many things, awareness of their surroundings, all kinds of improvements. So Syntonics, wearing it again for as little as 7 to 14 minutes a day, makes some changes electrically within the brain, almost like reprogramming the brain. And if a person is struggling, maybe they're struggling with reading, maybe they're struggling with writing or eye-hand coordination, and that writing is kind of messy and sloppy and inconsistent. Maybe it's uphill and downhill and the spacing is kind of crazy and all over the place. Those are indicators of vision problems that can be addressed. Maybe your child is not sitting still and focusing. They're looking off or they're distracted in the classroom, or you can't get them to sit still, hence the homework war. If that's what's going on with your child, and there are lots of things, you can do some research and you can look through some of our other videos for more information about some of the signs and symptoms that you might be experiencing if your child has vision problems. But know that these things are treatable and correctable. So phase 1 is Syntonics, to electrically reprogram the brain for better vision. Phase 2 is more hands-on, and that's part of their therapy program where you're working with a therapist. They're using specific tools and items that will allow them to be able to gain better visual skills. So better tracking, better focusing, better eye alignment, judging depth and perception and space around them. These are all things and also, when I mention alignment, realize that we're talking about patients who have strabismus or an eye turn. So, cosmetically, but not just even cosmetically aligning the eyes, we're talking about sensory aligning the eyes so the brain can use the two eyes better together as a team binocularly, the way they're meant to work. So there are so many things that we're looking at when we evaluate our patients, and parents come to us saying, oh my gosh, help. It's a homework war each night, right? We're looking, what is going on? Phase 1, Syntonics, electrically reprogramming the brain to better vision. Phase 2, hands-on, using tools, equipment, and different items to help your child gain better visual skill and help them to function in the classroom. Now, many people say, well, does that really work? Really? Is that anything that works? Okay, well, I did give you a couple of references here in the very beginning of the video, but also I'll tell you, yes, it totally does work. Most of our patients are able to gain anywhere from 3 to 7 grade levels of improvement in their reading skill ability. This is comprehension, or maybe it's reading speed and fluency. So yes, absolutely, these are measurable changes. We also notice patients have improved ability to listen and auditorily pay attention and follow directions. We notice things like more mature and age-appropriate behavior. We notice less tunnel vision when they're watching TV or playing video games, and more attention paying more attention to whenever you call their name out and ask them to do something. More willingness to do work, more willingness to be self-starters and do it on their own without you having to, browbeat them in order to get them to do the work they're supposed to do. Overall, we're talking about reducing the problem with the homework war zone that could be going on in your house. Now, if you're thinking that's, oh my goodness, what you absolutely want to sign up for this year, stop it now, please, no more homework wars, then simply connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can do two things: either schedule a consultation directly with me, or you can fill out a questionnaire. Roundaboutly, filling out the questionnaire is going to get back around to asking you, do you want to consult with us? If you don't, we understand that. We are really looking for patients and families who are serious about their vision improvement and who are serious about stopping the battleground from now on and not ever going back to that. If that's you, connect with us. And as I always in my videos, please like this video if you do like it. Pass it on to someone who could benefit from it. And obviously subscribe to our channel so you don't miss any of our notifications. Thank you.